I'm Dr. Madhusudan. I got the privilege of introducing Dr. Praveen Kulkarni, MD. He was graduated in 2008 from BDJT Homeopathic Medical College, Dharwad. He was awarded MD in Homeopathic Pharmacy from Father Mudas Medical College, Mangalore in 2012. Currently, he is pursuing PhD in Homeopathic Pharmacy from Bharati Vidyapit Deemed University, Pune. Currently, he is an associate assistant professor in the Department of Homeopathy Pharmacy at Dr. BDJT Homeopathic Medical College, Dharwad. He is working as co-investigator for a research project for faculty under sponsorship of RGUHS, Bangalore. Has 12 years of clinical experience and 9 years of teaching experience. He has been appointed as examiner as well as resource person for question paper setting for BHMS by RGUHS. Member of editorial team for in-house magazine Homeopathy Science Frontiers. Had volunteered as a drug prover during postgraduate learning. I'm here presenting Dr. Praveen Kulkarni, MD. Yeah, doctor.
Yeah, thank you, Madhusudan sir, for your introduction of me. At the onset, I thank Dr. B.D. Patel sir, patron of KQHDA, for this wonderful platform for the speakers to present their views. And even I'm thankful to Chairman Dr. H.L. Swami sir and President Sripad Hegde sir for continuing this particular work of spreading the awareness of homeopathy through this KQHDA meetings. And I am also thankful to Secretary Dr. Subha ma'am for her tireless effort to bring the sessions without any hazards. So with this, I start with my session. My session is on adverse drug reactions and the homeopathic management of it. So many of may be having the doubt why adverse drug reactions to be taken at this particular platform. So for this, let me tell you that nowadays adverse drug reactions are so much happening in our medical field that this adverse drug reaction is introduced as a chapter for first year students in homeopathic pharmacy. It was not there earlier, but now it is there as a chapter for them. So with this, you can make the magnitude of how the adverse drug reactions are impacting even our homeopathy. Okay, as a homeopath, so many times you may encounter the patients coming from other systems of medicines with adverse drug reactions, and you need to treat them. So at the outset, let me start with the session wherein adverse drug reactions and homeopathy. So here it will be an session with harm associated with use of allopathic medications and the homeopathic approach of the same. Okay. So here what you are seeing are the different types of adverse reactions which you may come across. It may be a single itch or rash which may be associated because of the taking of some allopathic drug, or it may be a condition which may endanger the life of a person. Okay, so it may go beyond that also. Okay, it may take the life of a person if at all it is not being tangled with. So with this session, at the end, the person who is attending the session, that person can learn adverse drug reactions, what they are, why they are, and how they occur. Okay. And any sort of adverse drug reactions in homeopathy, so any sort of chances of happening of this adverse drug reaction in homeopathy, that is what you need to you will be able to learn that one. And another one, that homeopathic approach to adverse drug reactions when they happen to the persons who approach with the other systems of medicine. Okay, so to introduce, they are commonly called as side effects in layman language. So whenever you will come across with any patients, you will, I have taken this drug and I end up with this side effects of that particular drug. So it is very common nowadays that you will be getting these words now and often. These adverse drug reactions are estimated as the 6th leading cause of the death worldwide. Okay, so whenever you hear this adverse drug reactions, the magnitude is measured by the cause being the 6th leading cause. Okay, so the this magnitude makes us to be a little bit vigilant whenever you treat any person with medication. Okay, not only that, we are treating with homeopathic medication, but still we should be a little bit vigilant whenever we use the drug for treatment of the patients. They are even major problem in clinical practice and drug development. As a pharmaceutical background, okay, as I have done my MD, so I know that how the drugs have been developed. Okay, it may not be new drugs development in homeopathy. Much of the scope is not there for the drug development, but for the development of some patents, whenever any patents have been um, been produced. Okay, so whenever they come across with any sort of problems arising with, then definitely that particular drug, the formulation has to be withheld. Okay, that is what is the routine thing what happens with the adverse drug reactions, and they are most common reason for drug withdrawal also. Okay, because any time whenever you prescribe any drug, if the patient complains of the adverse drug reactions because of that particular medication what you prescribe, then you are forced to withdraw that particular drug, and even they are the reason for the failure of new drug to come in the market. Okay, means because the total efforts of new drug development also is being evident with the adverse drug reactions. If adverse drug reactions are not taking place, then only the such drug comes to the market. Otherwise, that particular entire effort of bringing a new drug to the market will be futile. So, and even nowadays, because it is very much common, because new drugs are being discovered, and because of this, adverse drug reactions are become more and more. So coming to the definition, what do you mean by this adverse drug reaction? So this adverse drug reaction means it is a result of a drug therapy that is neither intended nor expected. Okay, means whenever you are giving a drug, okay, you will never be expecting that it is going to cause any harm to the patient, because the first foremost the duty of a physician is to not to cause the harm. If at all you are not doing any benefit to the patient, that's well and good, but at least you should not harm the patient. But without your knowledge, whenever you give a drug, then if that particular drug therapy is causing an unexpected change or unexpected result, then that particular thing is called as the adverse drug reaction, because of which you are forced to withdraw that particular drug, or you should nullify the effect of that particular drug whenever you give. So whenever the therapeutic use of drug is being seen, when it is seen that it is causing some harm, unexpected changes in the body of a person, sometimes even it may be a life-threatening also. Okay, so that is why whenever you treat any patient, you should be a little bit vigilant. That is what is the main motto of a physician whenever he treats the patients. Then coming to the types of adverse drug reactions. Okay, let me take this particular things, that what are the adverse drug reactions. Let me tell them in brief, so that I can go to homeopathic adverse drug reactions, if at all they are going to occur in homeopathy, and what are the remedial measures to be taken for adverse drug reactions in homeopathy. So types of adverse drug reactions, based on their occurrence, they are classified as A, B, C, D, E. So here the alphabetical letters are also seen wherever they are having the same headings like. Okay, so type A adverse drug reaction is called as augmented. Again, type B is called as a bizarre. Type C is either it may be chemical or chronic, because the exposure is very much chronic. Fourth one is delayed effect. Fifth one is exit of the treatment or end of the treatment or intake of the medication or the formulation. Okay, these are the types of adverse drug reactions which has to be dealt. So coming to one by one, we'll discuss the adverse drug reactions one by one. So type A is called as augmented pharmacological effect, wherein the effect is dose dependent and predictable. Okay, means one can able to formulate that correlate that this particular adverse drug reaction happens because of this particular thing, because I have taken this particular drug and this much of dose. That is why this has occurred. Even the layman, like the patient also can correlate whenever they are giving the history. Okay, whenever you ask the history of the medication, what they have taken, they can correlate that they have taken this particular drug, and because of this particular drug with this much of dose, it has happened. So it is totally entirely dependent on the dose, and it is predictable. Okay, means you can explain the causal relationship is there, means the cause is there for this particular effect to happen. So it is explainable that you can explain why it has happened. So it constitutes approximately 80% of the adverse drug reactions, whatever has been found. Okay, whatever they have been documented. So approximately 80% of the adverse drug reactions are are of this type of augmented pharmacological effect type of adverse drug reactions. They are caused by excessive dosing, that is too high dose of the medication, the same medication, but excessive dosing causes the problem. They are very much common, that is they are more seen more than 1% of the cases, but often not that severe, because the intervention is usually happens very early in such cases, because soon after some sort of any disturbances with the health, the patient usually runs to the physician, and they will uh, uh, correlate the things what they happened. Okay, and what they have taken, and what the medication they have taken, and then what dose. So whenever they tell, then usually the physician is comfortably able to prescribe the antidote for the things. Okay, what has to be done. So one of the example for this particular type of adverse drug reaction is hypoglycemia with insulin. Okay, so whenever the people with insulin dependency, whenever they take the insulin, but with error, sometimes because of some erroneous measures, if at all they have taken more amount of insulin, then they will end up with the hypoglycemia. If and this particular things becomes worse whenever they are a little bit fasting. Okay, means when they are not consuming the food very well, that time this effect will be very much severe. So it may end up with the hypoglycemic coma. Okay, that is also a sort of the problem which may arise with this particular dose dependent adverse drug reaction. Okay, so this is the type A. Type B is bizarre effects. So here the idiosyncrasy. As a homeopath, will be knowing very much about the idiosyncrasy. Whenever you talk of the drug proving, we'll talk of this idiosyncrasy also. Okay, whenever the person is idiosyncratic, then you cannot able to get the symptoms in a routine manner. Okay, that is what is being seen in the drug proving. If at all you come to this type B, wherein bizarre effects are being seen, this is dose independent and unpredictable, because here the person who has consumed, he is alone idiosyncratic to that particular dosage form. Okay, earlier the same dosage which was given to the other person, that person was not had any sort of complaints or adverse drug reaction, but this particular person is having some sort of problems with the dose what he has consumed. Means it is idiosyncrasy what is playing in this particular patient, and here this becomes unpredictable. Even the patient cannot correlate that it has because of this particular the medicine's dose, because it is totally idiosyncratic. Even the patient will not be having any idea why this has happened. Even the physician, if at all the physician is not going to give importance to causal relationship, then it will be very much difficult for him also to identify why it has happened. Okay, very relatively very rare, because idiosyncrasy is not been seen universally. Okay, idiosyncrasy is very much specific to some of the people. Okay, that is why it is very rarely seen. The same substance which can not cause anything to a person may cause a sort of severe problems to some other person because of this idiosyncrasy. That is why it is relatively very rare. It causes in very less than 1%. May occur with very low doses of the medicine. Okay. Sorry. Okay. So may occur with very low dose of the medication because it is very much individualistic to that person because of the idiosyncrasy. The examples to be given for this particular type of adverse drug reaction is drug allergy causing the skin rashes. Okay, whenever earlier days that whenever the penicillin was given, the skin sensitivity test was done earlier days because that particular drug was allergic to some people. So that used to cause the skin rashes. Whenever it was mild, then the penicillin was being given. Otherwise, that particular drug was not indicated to that person. So it is one of the um, adverse drug reactions for this type 2 type of adverse drug reaction. Okay, coming to type C, it is chronic effect. So it is after chronic administration or continuous usage of the medication. It happens when the drug is taken for a longer time. Okay, it will not happen immediately, but it takes its own time to manifest its adverse drug reaction. And whenever such thing happens, probably so many times it may not be reversible. Okay, because that patient got exposed to that particular drug for longer time, and whatever pathological changes have been taken place, it would have been taken. Okay, so but still we are having some scope for the treatment of these things, but only what matters is to what extent the damage has occurred. So to give example for this particular thing, analgesic nephropathy after the treatment with analgesics. Nowadays we are seeing that whenever a doctor prescribes any of the analgesic to patient, okay, they do prescribe some course like 1 week or something, like maximum 1 week, but the patients being a little bit sort of like what you can call them as clever. Okay, they do take this analgesic without the consultation of the doctor in the future time. Okay, and whenever they feel comfortable with that particular analgesic, they try to continue that particular therapy for longer and longer time without giving any um, thought for what damage they can cause at the future. So this is one of the things, that is analgesic nephropathy after treatment with analgesics. And even you can see that osteoporosis is happening with the steroidal treatment. Whenever the steroids are taken for longer and longer time, even the steroids are the reason for obesity, what the patient suffers with so many times. And coming to third one, this dyskinesia due to antipsychotic drugs. Okay, whenever the patient are on the treatment of antipsychotic drugs, the person suffers with the dyskinesia. And very popularly known to so many of us is that paracetamol may cause hepatotoxicity whenever it is not being taken as advised by the physician, because there is a time gap for the paracetamol to take. Okay, if at all it is not been maintained, and if at all it is taken for the chronic time without the consultation of the proper consultation of the doctor, it may end up with the hepatotoxicity, wherein the the cells of the liver may get damaged, and it may go to extent that it may not be reversible so many times. Coming to next type, that is type D, delayed effects. Okay, so here the effect happens, but it will be very much delayed. Okay, means the drug is been taken, and the drug is being withdrawn also. Okay, the person is not taking continuously. As you are seeing in the type C, the drug was continued for the longer time, but here the drug was not continued, but it was taken some earlier time, and now this particular drug is not been taken, but the effect of that particular drug is seen now. So the duration or critical time exposure is lengthy and not an immediate one. So one of the classical example for this type of delayed effect is use of contraceptives causing delayed in conception. Okay, nowadays in couple, this particular trend is more that they use the contraceptives for not getting issues. Okay, not to get the issues. Okay, but that contraceptives are having their own side effects or adverse drug reactions, wherein after withdrawal of contraceptives also, even the couple are trying to get the issues, they are unable to have the issues or the babies because of this delayed effect of that particular contraceptives what they have taken in the earlier time. So this is one of the classical example where you are seeing that the drug which has taken in earlier time has caused the problem now. Okay, so whenever you take the case, you will be coming across with these particular things. whenever the person, a couple come with the problem with issues, when you take the such cases, you will have this history of usage of contraceptives. So here the scope of homeopathy lies, and I will discuss that particular thing later on. Okay, type E, at end of treatment effect, that is called, usually called as withdrawal effect. Okay, it may be the drug which you take, or even the substance, even like substance like alcohol and tobacco. Whenever you withdraw them, whenever you make the patient to stop them, then they have some sort of effects which are called as the withdrawal effects. A classical example for this one is corticosteroids. When you stop them from the patient to take, then they will end up with the adrenal insufficiency. And beta blockers, when you stop them from the patients, then they get the worsening of the angina. Okay, even there will be a precipitation of MI, myocardial infarction. So this type of and the last one is the opioids, epileptics, anxiolytics, which all cause the rebound phenomena of the hypnotics also. Whenever the persons take such drugs, okay, here I'm using the word drug. Okay, so when they are taken and you don't have the control over that one, then usually it becomes the like a addiction. So whenever it becomes addiction, then usually it ends up with the a sort of addiction. So when addiction takes place, then the first line of treatment is called as the withdrawal. Okay, you should make the person to withdraw the particular substance which they are addicted for. Then soon after you withdraw that particular substance, then the patients end up with some of the symptoms which are called as the withdrawal effects. Okay, so coming to these were about the adverse drug reactions and types, and adverse reactions and homeopathy. So with this particular topic, I want to highlight on whether such type of adverse drug reactions are going to happen in homeopathy. So whether any sort of scope for adverse drug reactions in homeopathy. So there is a naive assumption in homeopathy that because of the diluted doses of the medication, homeopathy must be safe. Okay, usually whenever you tell the patient, even the patients are also more informed than us, that they will tell that we have come to homeopathy because there is no side effects or there is no adverse drug reactions. But in terms of safety concerns, the homeopathic remedies themselves are mostly considered harmless. Okay, because they are usually used as a diluted medicines, diluent medicines. So whenever dilute medicines are used, when there is no substrate presence, then any causing of any sort of harm to the body is very least. So, but homeopathic remedies do have adverse drug reactions. It's called as indirect. Okay. So whenever the adverse drug reactions are studied, they are studied as direct effects and indirect effects. So direct effects are related to the substrate or the drug itself, but whereas indirect is related to the person who is using them or who is prescribing them, like physician. So here the adverse drug reactions are possible in homeopathy, but it is a sort of indirect way, wherein a practitioner with limited medical and homeopathic skills may overlook serious complaints and thereby cause a delay in necessary conventional treatment. Okay, means wherever it has to be intervened, at that time the practitioner may not intervene and he go on neglecting the adverse drug reactions whichever taken place in homeopathy, and it ultimately end up with the adverse drug reactions in homeopathy also. But here let me tell you, this is not the direct one, and it is not related to the medicine which you use, but it is related to the practitioner who prescribes the homeopathic medications. If at all they are they are prescribing, then only remedies of the low dilutions have a potential to induce the direct risk. Okay, so that is why I was telling in the earlier slide that if at all the risk occurs in homeopathy, then it is indirect type of risk, not the direct risk, because the direct risk is only possible when you take the low dilutions like mother tinctures. Okay, the mother tinctures are not free from adverse drug reactions. Let me tell you, because they do have the substance. Whenever there is a presence of the substance, then they factually do the adverse drug reactions. So any potential harm related to remedies of high dilutions, if the high dilutions are prescribed, then also the adverse drug reactions taking place, then it is called as indirect risk, which is related to the practitioner, which I already discussed in the earlier slide. Okay, wherein we have to blame to the practitioner. So it can be concluded that adverse drug reactions homeopathy is very rare. If at all it occurs, it is due to practitioner's problem rather than the drugs. Okay, means here the homeopathic practitioner should be a little bit vigilant whenever they prescribe homeopathic medicines of lower potency. Okay, that is why the CCRH, Central Council for Research in Homeopathy, has limited usage of some of the lower potencies of some medicines. Okay, wherein they are found to be either poisonous in their crude state, or they might be a little bit dangerous whenever they have been prescribed in the lower dose. So such potencies are not available in market, but still sometimes the mother tinctures of such drugs, I have seen that they are available in market. Okay, maybe because of the failure of some sort of rules what the government has made. So the rest, the Naxomica mother tincture, and such other mother tinctures, wherein Naxomica is known to be poisonous in its crude state. So it should not be prescribed at the lower doses like mother tinctures, but still it is being prescribed so many times. So that is why the last sentence for this particular session is that homeopath may fail, but not the homeopathy. So here it concludes that homeopath, being a practitioner who is a little bit negligent about his duties, may fail, but not the homeopathy. Means here we should not blame the medication which we prescribe, but we should blame the homeopath who prescribes such medicines which may cause the harm to the patient. Okay, then coming to third session, that is homeopathic approach to adverse drug reactions. So adverse drug reactions, whenever they occur, you will come across with the persons coming from other systems of medicines. Okay, so homeopathic practitioners often encounter cases coming from other systems of medicines, and most of the cases are directly or indirectly linked to adverse drug reactions caused by medications of any systems of medicines. Even I am taking the name homeopathy also, because you may encounter the patients coming from homeopathy also, wherein they have encountered adverse drug reactions. So it becomes your duty to nullify those adverse drug reactions, even they are coming from our systems, that is homeopathy also. So often patients might reach up to physician with fully blown adverse drug reaction, wherein the condition may be a little bit severe so many times. In such an event, a homeopath should be enough vigilant to trace the causal relationship. What might have caused that particular adverse drug reaction? What type of adverse drug reaction it may be? So I have discussed about the 5 types of adverse drug reactions in the earlier slides. So the physician should be vigilant to try to rule out what might be the causal relationship, what might be the cause for the adverse drug reactions which has occurred right now, and what should be my scope to treat such adverse drug reactions. So whenever such vigilance is being maintained by the homeopath, then it becomes a little bit easier task to counter this adverse drug reactions. In clinical practice, adverse drugs may be represented as drug allergy, side effects, or drug sensitivity. Okay, so the adverse drug reactions, the clinical representation of the adverse drug reactions may be like in the form of allergies, or maybe in the form of side effects, or maybe in the form of sensitivity to a particular drug, or maybe for the substance also. So when you search in the repertory, whenever you go through with this particular adverse drug reactions, then your area of search in the repertory should be abuse of drugs. Okay, this is the main chapter wherein you will be finding in general you will be finding so many remedies being being tabulated, wherein you will be finding the drugs of first grade, second grade, and third grade remedies which are being used from ages together in homeopathy for the treatment of adverse drug reactions. Then oversensitive to drugs and ill effects of vaccination, bad effects of, okay, here bad effects of what? It may be a substance, or it may be a sort of medication also, it may be the vaccination also, whatever. So bad effects of, in general, if at all you search as in bad effects of, then you will be coming across with so many things. Substance abuse, whenever you take any substance in excess, it may be like alcohol. Whenever alcohol is taken in excess, then it becomes a sort of problematic. That is, it may cause the adverse drug reaction, sort of things like. Then substance sensitivity to. Okay, here sensitivity to substance is also a very matter of concern. Okay, I can correlate one example here. When I was doing my PG, pursuing my PG homeopathy in Father Muller's, I came across with a patient who had sensitivity for Bengal gram. Okay, so whenever he used to have any food having the Bengal gram, then that person used to have the fluffing of the face, edema of the face, as well as the fluffing of the lips. Okay, this is what was seen. So when I was doing PG, then I came across with this particular patient, and under the office, the medical person who was practicing that time, when I took the case, then Dr. Prasanna Kumar sir was there as the person in charge of that particular OPD on that day. Then he traced out that this is because of the sensitivity for that particular substance, which is called a Bengal gram. Whenever he used to take the substance in unknowingly also, okay, it was being tried that without the person's knowledge, without telling that what the ingredient of that particular thing is, still the person had the sensitive to that particular substance, that is Bengal gram. So we have concluded that it is because of the sensitivity for that particular Bengal gram. Then what sir took the step is he gave Bengal gram to us. Okay, and as a being PG of pharmacy, I was a little bit engaged with the trituration so many times, even succussion also. Means my scope of area of research. So I went to sir took Bengal gram powder from one nearby shop, and he told me that I should triturate this particular Bengal gram powder. Okay, then I triturated it for 1C, 2C, and 3C. Okay, I purposely did in centesimal scale, because after 3C, the substance becomes liquid insoluble. Okay, as you see that in centesimal scale, you can triturate it up till C, and if at all you are choosing this decimal scale, then you have to triturate it till 6x. So I purposely chosen the centesimal scales because of reducing the effort what I triturate. So I chosen the centesimal scale and I triturated for 1C, 2C, and 3C. After 3C, I have succussed it, and I have prepared 30th potency. Okay, of that Bengal gram. Well, I was not knowing that whether medicine prepared from Bengal gram was there in homeopathy or not. But even with the instruction of my senior, Prasanna Kumar sir, I triturated that particular Bengal gram, and when the patient arrived to the OPD next visit, we have prescribed that Bengal gram 30th potency to him. Okay, Bengal gram 30th potency to him, and to our surprise, he was recovered from that particular substance sensitivity, and he was able to consume foods made from the Bengal gram. Okay, here my aim is not to tell that it may be a isopathic mode of treatment, or it might be whatever, but here the substance sensitivity will be there for so many people. That is what I want to highlight. Okay, so whenever you search in the abuse of addiction, oversensitive to quick reaction, and even for the vegetables. So vegetables, not only vegetables, even for the other substances which are eateries. Okay, that is also possible. So whenever you repertorize, if you give only a simple research as abuse of or poisoning with the drugs in general, then you will come across with plenty of medications. What you are seeing here, the repertorial sheet, total sheet you can see here. It started with hydrastis, lobelia, naxomica, Agnus castus aloe, arsenicum, baptisia. Okay, so many medicines have been coming to the repertorial sheet. Okay, so I have relied on the Patak repertory and Kent repertory and Burik repertory for the selection of the medicines from the rubrics. So when you search in the Patak repertory that drug abuse of, then the naxomica comes as the first grade remedy, which is oftenly indicated medication, whereas calcareous carb, pulsatilla, hydrastis, and sulfur are second grade remedies which are also indicated so many times. And you see that aloe, hepar, natrum, arsenic, chamomilla, nitric acid, seckel core, camphor, colocynth, kali iode. These are oftenly indicated remedies, but they are having weightage of 1 mark. Okay, when you search the adverse drug reactions, some problems associated with that one, like constipation because of the drugs abuse, then you will get a different set of medications like colocynth and naxomica. So this they
Dr.
are,
Praveen,
sir.
can you conclude another 2 minutes?
Sir, yes, sir. It is almost coming to end. Okay.
Yeah.
So colocynth and naxomica are the next the medicines which are of importance, and bryonia, hydrastis, and opium are second grade medicines for the same sort of constipation. And agaricus, china, lachesis ruta, antimicrobial, and sulfur, they are the next medicines which are often indicated medicines. Then if to search in the boric, then the same drug in general abuse of, then you will get a naxomica again. So here what we can conclude is I have searched in the Murphy there alcoholism. If at all I search as alcoholism, then you will be getting plenty of medicines. Okay, the withdrawal, how to withdraw, how to help the person to withdraw the alcohol. So if you search for that one, then also you'll be getting so many medications. Okay, so vaccination, ill effects of vaccination also. So different types of vaccination will be getting here: DTP, diphtheria, meningitis. So many types of the vaccinations have been included in the national vaccination schedule. So many times we will end up with the patients coming, means the pediatric patients coming with some adverse drug reactions because of that particular vaccination. Okay. So to summarize, naxomica is frequently indicated remedy with first grade in different types of adverse drug reactions. After naxomica, carbohydrates, hydrastis, pulsatile, and sulfur are indicated for adverse drug reactions in general. For specific ailments arising from adverse drug reactions like constipation, naxomica and colocynth are indicated, whereas bryonia and hydrastis, opium follows them. Then indigestion occurred due to adverse drug reactions. The naxomica is the only indicated remedy which you will be seeing in the FATAC. Ill effects of vaccination, you will be having so many set of remedies to lead them: melandrinum, mesarinum, sarsaparilla, silicea, sulfur, thuja, vaccinum, and zincum. Okay. Then tobacco dependency, if you take the tobacco dependency, so many times you will be coming across with the patients who are having tobacco dependency and they want to get rid of that one, but they are unable to. Then as a homeopathy physician, it becomes your role to help them to get rid of that one. So plantago, which creates aversion for the tobacco. Tabacum can be prescribed to eliminate the toxins because of the tobacco chewing. Ignatia can be used to remove the anxiety because of the tobacco chewing. Caladium for the boil irregularity. Okay, so many are having the habit that if at all they are not having the tobacco at the in the lip, then they cannot pass the bowels. So that type of dependency also can be seen. So caladium can prescribe for such people who are having bowel irregularity because of the dependency. Then lobelia for withdrawal of the tobacco. Naxomica for the stress insomnia caused due to tobacco dependency. Steptaxia to de-addict the tobacco. And when you take the alcohol, then agaricus, arum, china, Crotalus horridus, lachesis, naxomica, ranunculus bulbosus, sulfur, veratrum albol, they are the first grade remedies for the alcohol dependency. And antimcrude, apocyinum, carbohydrate, graphitis, helleborus, ignatia, phosphorus, quercus grandiferous are the next grade of medicines for the alcohol dependency. Okay.
Okay.
So to conclude, the adverse drug reactions has to be thought seriously because they are the sixth leading cause of death worldwide, and they are the major problem in clinical practice as well as the drug development also. And even in homeopathy, it may not be an area of concern pertaining to adverse drug reaction because the usually used medications are high dilutions. But if it occurs, it is due to practitioner's fault, not because of the homeopathic drugs. So adverse drug reactions are not that severe in homeopathy, but the patients, the homeopathic physicians do encounter with the patients coming from other systems of medicine, wherein we are having a scope to prescribe the medication for the same. Homeopathy is having good scope in treatment of adverse reactions of any system of medicine if physician is capable to trace the causal relationship. Means they should be able to trace out why they have occurred and what type of category adverse drug reactions are of. If at all you can able to conclude then a causal relationship, you can conclude, then the treatment will be very much easier. So with this,
Yeah,
I conclude.
okay. Yeah.
I conclude my session. Thank you. Thank you, everyone, for giving me opportunity for